What is going on, world? Hey, first of all, welcome to 2024. You already know the deal. Y'all already know the deal. You already know what's up. We are doing NCLEX questions. First set of NCLEX questions for the year of 2024. And hear of our Lord, or, whoever it is you worship. My name is Kevin. I go by the Boot Nurse. Check me out on all those social media platforms. I don't know why this light is like so bright. I'm gonna have to figure that out. But shout out to everybody that's in here rocking with me. You guys already know the deal. Hey, get me to 1,000 likes and let's get 100 followers up in here, and we're about to get it rocking. Hey, also I want to know who you are, where you're from, where you're at in your nursing journey. Is it Malia? Appreciate you. Happy New Year to you as well. Welcome to 2024. Hopefully, I don't know if anybody just saw my story that I posted, but hey, there's no such thing as that new year, new me shit. It's new year, improved you. I mean, nothing about you changed in the last 12 fucking hours. You know what I'm saying? Or less than 24 hours. You know what I'm saying? So I'm just letting y'all know. Y'all got to put that work in. Also, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. I'm in my prerequisites for nursing. That's a shout out to you. Hey, before you know it, that journey, you're already going to be there. Kiki, Happy New Year to you as well. You guys already know the deal. I appreciate everybody here rocking with me. Also, how was you guys' New Year? Hopefully everybody had a safe New Year. I know other people be trying to shoot some glizzies up in the air as fireworks. That's not safe. Don't do that. Because what goes up must come down, as they say, right? Happy New Year. I'm taking MedSurg January 8th. Shout out to you, Chocolate. Hey, before you know it, you're going to be all the way through it. You know what I'm saying? Hey, but make sure you get into a small group of people and you start knocking it out. 25% can get you 100% of those benefits. All right. Hey, look, like we got 100 folks up in here. I don't got 1,000 likes, but I need for you guys to smash that like button. I need for you guys to share and for you guys to follow. How long do you recommend studying for NCLEX? At least 30. It all just depends on where you are in your nursing journey. But I usually tell people no less than 30 days, but no more than 90 days. But here we go, y'all. Welcome. That's still my same beautiful face with the redness that we got going on over there. I have to take my PN soon. Hey, start studying for it, Nika. Start studying for it. I'm old. I was asleep before the new year. I don't feel bad. I was about to fall asleep too. But here we go, y'all. We're doing these NCLEX questions Monday, Wednesday, Friday. I appreciate everybody here. Hey, just because it's the first, I don't care. I don't care nothing about y'all nursing, no hangover. All right. We're all responsible adults here. You know what I'm saying? So I appreciate y'all. But here we go. Question number 1. Among the following signs and symptoms, which would most likely be present in a client with mitral regurgitation? Is it altered level of consciousness, exertional dyspnea, increased creatinine phosphokinase concentration, or is it chest pain? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got these questions off nurseslabs.com. Free sets of questions. Make sure you guys go over there and check those out for yourself. And make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. That is the trifecta that TikTok wants. Hey, we're in 2024, y'all. We're in 2024. Also, if you are new here and you have never been to any of my lives, just let you know I talk a lot. No part of me cares if you care about that. But what you can do is smash that like button, share, and follow. You know what I'm saying? Somebody told me that my lips were ashy and I should drink water. So I just drank some water and I'm putting on chapstick. So I'll just let y'all know what's up. Just answer the question. Nah, how about Coco? How about you just sit there and chill? And if you don't like when I answer the question, then, the great thing about TikTok is that ass can go away. You must be new here. We don't run on your time, we run on mine. All right, y'all, here we go. Somebody says B and D. No, it's just one. Here we go. But here's our answer. And 3, 2. And the answer is B, exertional dyspnea. It says, bro, you doing too much. Hey, if I'm doing too much, you can go away too, Javier. What the hell you think this is? Is that your TikTok guy? Mitral regurgitation is defined as an abnormal reversal of blood flow from the left ventricle to the left atrium. All right. Weight gain due to retention of fluids and worsening heart failure causes exertional dyspnea in clients with mitral regurgitation. That's part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right. 11 to 17%. It says, we trying to study NCLEX. Oh, hey, I'm trying to teach y'all NCLEX. That's what I do. I do this. You must be new here because I don't remember that name popping up on here. But hey, so the answer is B. Remember, physiological adaptation, third largest section on the NCLEX exam. Okay. After seeing these questions for a while, you kind of start to know what categories that they fall under. All right. Here we go. Question number 2. Chris, with a history of chronic infection of the urinary system, complaints of urinary frequency and burning sensation, to figure out whether the current problem is of renal origin, the nurse should assess whether the client has discomfort or pain in the what? Is it urinary meatus? Is it pain of the labium, the suprapubic area, or the left or right costovertebral angle? What are we thinking? Gwen says, thank you for all your help. Of course, Gwen. I ain't worried about people that be coming over here telling me what to do. Miranda says D. Like, this is my TikTok and you getting it for free. The fuck are we talking about here? Hey, so appreciate everybody in here rocking with me. Hey, make sure you guys keep smashing that like button. Make sure you guys keep sharing. Make sure you guys keep following. Hey, that's what gets this out to the people that need it. It gets it out to the people that need it. Also, I got these questions off nurseslabs.com. If you don't like the way I do TikTok, you can go over there by yourself and do them by yourself. You can do that. Also, if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what you doing here hanging out with us? D for kidney. Gotcha. Shit posting 101. Shout out to Lubbock. I live in San Antonio. Okay, I appreciate you too. D is what it says after. Okay. One bad chick says D. Okay. Shout out to all y'all. Give y'all 10 more seconds. Is it Panacala? Panacala says hi to you. Shout out to Mesquite, Texas. North Kakalaki. I see you out there. Take NCLEX okay, next week. Not a nurse, just here to learn. I appreciate you. Here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is D, right or left costovertebral angle. Discomfort or pain is a problem that originates in the kidneys. It is felt in the costovertebral angle on the affected side. Flank or costovertebral angle tenderness is most commonly unilateral over the involved kidney, although bilateral discomfort may be present. That is also part of physiological adaptation, which is the third largest section on the NCLEX exam. 11 to 17%, y'all. The top sections are management of care, physiological adaptation, and pharmacology. They make up 44 to 49% of the entire NCLEX exam. All right. So, hey, I'm telling you, don't try to stray away from farm. Trust me and believe me, it ain't going nowhere. All right. And same thing with physiological adaptation. All right. Have you started shirts yet? I do. If you go to my website and you hit some shirt, if you go to apparel, you will see it on their website, thebootnurse.com. You can check that link out in my bio. Also, here we go. Question number 3. Nurse Perry is evaluating the renal function of a male client. After documenting urine volume and characteristics, Nurse Perry assesses which signs as the best indicator of renal function. Is it blood pressure, consciousness, distension of bladder, or pulse rate? What are we thinking? What are we thinking? My family calls me Renee. I'm bridging to the arm. Okay, shout out to you, Renee, in Illinois. All right, I see you out there. Shout out to all 400 plus of you guys in here rocking with us. Make sure you guys share, smash that like button, and make sure you guys follow. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Nurse Perry here. Shout out to you, Nurse Perry. All right. All right. What else do we got? I'll give you guys 15 more seconds. We're kind of all over the place. Blood pressure. Okay. C. Okay. Okay. Vermont. Who lives in Vermont? Who lives up there? Well, besides you. Florida. Okay. Shout out to Florida. I lived in Florida for a couple years. Jacksonville. Shout out to Duval County. Duval. All right, here we go. Here's our answer. Shay says A for final answer. All right, here we go. Here's our answer in 3, 2, and the answer is indeed it is A. Hey, I'm not really a big fan of Atlanta because I'm really hearing about what the restaurant. Hey, Keith Lee got me disliking Atlanta. You know what I'm saying? But no, I'm just playing. No shade to y'all. But here we go. But the answer is B. Perfusion can be best estimated by blood pressure, which is an indirect reflection of the adequacy of cardiac output. That is part of physiological adaptation. All right, third largest section on the NCLEX exam. All right, 11 to 17%. Also, you guys need to realize that those three make up anywhere from 44 to 49% of the entire exam. When you guys are studying, you guys need content, you need Q&A with rationales, all right? And when you're going through your questions, this is exactly how I want you to do them. Read them, keep reading them. You don't understand the question, read the answers. The answers will tell you what the question is asking. And then you read your rationales. Whether you got it right or whether you got it wrong, you will read them all the time. All right, here we go. Question number 4. John suddenly experiences a seizure, and Nurse Gina notices that John exhibits uncontrollable jerking movements. Nurse Gina documents that John experiences which type of seizure? Is it tonic seizure, absent seizure? Is it myoclonic seizure or clonic seizure? What are we thinking? What are we thinking? Hey, I just want to let y'all know, hey, we're on the road to 10,000 likes. I need 10,000 likes. If I get to 10 questions and we don't got 10,000 likes, I promise you I'm going to boycott the rest of these questions. I promise you. You better hey, for y'all that are new here, y'all better ask. Y'all that are not new here, y'all better let him know. He'll be like, he's serious. A is a dog. L is in dog. Okay. No idea. That's okay. Hey, I would rather you guess. Appreciate the 2020. Okay, Miss 2024. I appreciate you, Miss Renee. But hey, I would rather you guess. You have a 25% chance of getting it right than not answering it at all and then getting a 0, right? So here we go. Here's our answer. Here is our answer in 3, 2. And the answer is C. It's a myoclonic seizure. Myoclonic seizure is characterized by sudden uncontrollable jerking movements of a single or multiple muscle group. Myoclonic is defined as rapid, brief jerking or shock-like movements involving muscle or groups of muscles, right? Also part of physiological adaptation. Shout out to all y'all getting it right. Also, this is for RNs and LPNs, okay? RNs and LPNs. Biggest difference between LPN and RN is for LPNs, you need to know what you can and can't do and what you can and can't accept. That's the biggest difference. I promise you, that's the biggest difference, all right? Physiological adaptation, 11 to 17%, all right? So shout out to all y'all. Oh, yes, of course, and pay. I don't know, Chaz. I know some LPNs that travel out there that make more than staff RNs. So, see, now it depends. It depends. But here we go. Question number 5. Smoking cessation is a critical strategy for the client with Berger's disease. Nurse Jasmine anticipates that the male client will go home with a prescription for which medication? Is it paracetamol? Is it ibuprofen, nitroglycerin, or is it nicotine? What are we thinking? In my last semester of BSN, shout out to you. In NY, trust me, it's paid for the most part. Oh, I believe you. My cousin lives in New York City, and she's an LPN, and oh, I know it. She gives me the skinny. She lets me know what's up. Hey, if you guys are new here, welcome. We're doing NCLEX questions, both for RNs and LPNs. Got these questions off nurseslabs.com. You guys can go over there and check those out for yourself if you don't like my teaching methods, but you know, I still love y'all nonetheless. If you guys are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. All right. And we're on the road to 10,000 likes. I'm just saying, if I don't get 10,000 likes by the time I get to 10 questions, get carpal tunnel for me. According to military medical, it's always ibuprofen. Shay, ibuprofen, change your socks. You know the deal. Here we go. Oh my God. Oh, hurry up. Oh my fucking God. Who just told me hurry up? Oh my fucking God. Heidi, I didn't realize we were on your time. Heidi. So, all right, here we go. In 3, 2. And the answer is D. It is nicotine. Nicotine is given in controlled and decreasing doses for the management of nicotine withdrawal syndrome. Nicotine replacement therapy is for those who want to quit smoking, as abruptly quitting can cause withdrawals and cravings. That is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Smaller section, right? Smaller section on the NCLEX exam, but still very important. It's still one of the 8 client needs that is part of the NCLEX test plan, okay? All right, let me take that test. Go take that test, girl. Go take it. All right. Hey, real quick, for anybody that is interested, I have a free PDF that's linked is in my bio, or you guys can go to that website. We're talking about test taking tips on how to conquer the NCLEX. It's free to you guys. Just go over there, check it out. All you need is your email, and then it'll get sent directly to your email. You guys can go see what that's about. All right. What is the pay difference in RN different states? It just depends on the state. Okay. Here we go. Question number 6. Nurse Lily has been assigned to a client with Raynaud's disease. Nurse Lily realizes that the etiology of the disease is unknown, but it is characterized by what? Is it episodic vasospastic disorder of the capillaries, of the small veins, of the aorta, or of the small arteries? What are we thinking? Shout out to all you guys that are out here hanging out. Welcome to 2024, January 1st, probably hungover. So I appreciate you guys being here. We're doing NCLEX questions. Got them off nurseslabs.com. Hey, by the way, if you come in here and you rush me, like, I promise you I'm gonna ban you. I literally just banned like 3 people, and I thoroughly enjoy it. So I'm petty, and I will talk shit about you at the end of the day too. Here we go. Hey, yo, here we go. Here's our answer. Everybody's screaming A at me. So here's our answer in 3, 2. And the answer is D. It's episodic vasospastic disorder of the arteries. Raynaud disease is characterized by vasospasms of small cutaneous arteries that involve fingers and toes. And Raynaud phenomenon blood flow restriction occurs during cold temperatures and emotional stress. Specifically in Raynaud phenomenon, there is vasoconstriction of the digital arteries and cutaneous arterioles. That is part of physiological adaptation. All right. Physiological adaptation, which is the third largest section on the NCLEX exam, 11 to 17%. Okay, both for RNs and LPNs. Beverly, retired LPN. Shout out to you, Miss Beverly. Shout out to you. All right. So, hey, this is where, if you got the question wrong, this is where you go back, you read the question, read the answers, read your rationale, understand why you got them wrong. Understand why you got it right. And then remember it, take down notes, do whatever you need to do, and improve upon as you go forward. All right. Here we go. Question number 7. Nurse Jamie should explain to a male client with diabetes that self-monitoring of blood glucose is preferred to urine glucose testing because of what? It's more accurate, it can be done by the client, it is easy to perform, or it is not influenced by drugs. What are we thinking? Shout out to all 600 y'all in here rocking with me. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, if I can't get to your question, because there's like 600 plus of y'all and there's only one of me, drop them down in there, and I'm pretty sure we got some seasoned nurses that'll answer your questions that are down there too, okay? So also make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. Gabby from Chicago, shout out to you. I saw Chicago, the ball drop on the telly. I'm in the middle of my LVN program. I say see, okay, I'm gonna give y'all 15 more seconds. Georgia, see you out there. Texas, Winder Eva? My gut tells me A. If your gut tells you A, pick A. Samir, my BSN program. Okay, just graduated. Shout out to you, Emily. Okay, all right. I see y'all. Pick you. I think B2 though. Hey, whatever. Hey, give me one and then run with it. Here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is A. It is more accurate. Urine testing provides an indirect measure that may be influenced by kidney function, while blood glucose testing is more direct and accurate measure. Accurate measurement of blood glucose is superior to the capillary blood glucose test. However, this is dependent on the laboratory meeting established industry standards. That's part of health promotions and maintenance. All right, 6 to 12%, part of the 8 sections of the NCLEX test plan. Hasn't changed. Still very important. You got to know it. How do we prevent these things, right? How do we, not only do we prevent, but do we promote good health to our patients? And not only good health, but also good information, okay? Here we go. On to the next one. Getting ready for that RN NCLEX. Shout out to you, Miss, Mary Ann? Shout out to you. Here we go. Question number 8. Jesse weighs 210 pounds on admission to the hospital. After 2 days on diuretic therapy, Jesse weighs 205.5 pounds. The nurse could estimate the amount of fluid Jesse has lost, which is what? Is it 0.3 liters, 1.5 liters, 2 liters, or 3.5 liters? Retesting from Georgia. Shout out to you. Hey, for all my folks that are out there, in case you didn't know, I failed my NCLEX 3 times. I failed it 3 times. No part of me cares. No part of me cares what you think about that. Would I recommend Archer or UWorld? I personally like Archer, but UWorld is just as great if that's what you feel that you like for yourself. All right. Hey, I failed the NCLEX 3 times. Once at 75 questions, once at 265, and the other one at 106, and then I passed on my 4th attempt. Nobody cares. Nobody cares how you feel about that. You gotta dust those tears off, and you gotta keep it pushing. All right. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is 2 liters. 1 liter of fluid approximately weighs 2.2 pounds. A 4.5 pound weight loss equals to approximately 2 liters. Diuresis is necessary for a variety of edematous and edematous conditions. I was going to say epidematous, which require clearing out excess water when the body abnormally sequesters fluid in third space in the form of edema. That is part of physiological adaptation. Third largest section on the NCLEX at 11 to 17%. I appreciate everybody smashing that like button. We got like 1,000 people up in here. Appreciate everybody. Appreciate all y'all. All right, here we go. On to the next question. Here we go. Question number 9. Nurse Donna, shout out to all of whoever's name is Donna in here, is aware that the shift of body fluids associated with intravenous administration of albumin occurs in the process of what? Is it osmosis, diffusion, active transport, or filtration? What are we thinking? What are we thinking? Also, if you guys are new here, these questions are from nurseslabs.com, both for RNs and LPNs that are taking NCLEX, or if you're in school or whatever. You guys can go over there and check those out. Free sets of questions. Also, if you're about to start nursing school, if you are looking for how to do nursing care plans, nurseslabs.com is phenomenal. It's great. I used it when I was in school. Nurses used it before me. You know, it's not cheating. I don't care what your professors tell you. They're lying because it's not cheating. All right, y'all. Here we go. 10 more seconds. Marco No Polo, appreciate the follow. Jess, thank you for the follow. Jenny, thank you for the follow. Here we go, y'all. Here we go. Nurses Lab is the only way I write care plans for class. Hey, shout out to you, Rebecca. I ain't mad at you. Here we go in 3, 2, and the answer is A. It's osmosis. Osmosis is the movement of fluid from an area of lesser solute concentration to an area of greater solute concentration. That's part of physiological adaptation. Third largest section on the NCLEX exam, 11 to 17%. You guys are going to hear me say that over and over and over, because by the time you guys start studying on your own or doing whatever, you guys will understand like what type of questions these they fall under for specific categories. Okay, so remember, you need content, Q&A, rationales. You need to go through why it's right, but then also you need to understand why it is wrong. Okay, why it is wrong. I'm very thankful for Nursing Lab. Hey, Nursing Labs is great. Here we go. Question number 10. Myrna, a 52-year-old client with a fractured left tibia, has a long leg cast and she is using crutches to ambulate. Nurse Joy assesses for which sign and symptom that indicates complication associated with crutch walking. Is it A, left leg discomfort, B, weak bicep brachii? Is it C, tricep muscle spasm, or is it D, forearm weakness? What are we thinking? Y'all? Hey, also, on the road to 20,000 likes, y'all. Hey, we're at question number 10, and y'all got me to 17,000 likes. I'm so proud of y'all. Y'all got carpal tunnel for me. How do you feel about simple nursing as a study guide method? I think simple nursing is cool. All right, what are we thinking? Got B, got A, we got another B. Amy says B. Let's see. VB Vibin says B. No, it says A. I'm sorry. VB Vibin says A. Oh, God, I don't miss this nonsense. I bet you don't. Here we go, y'all. Here's our answer. In 3, 2. And the answer is D, forearm weakness. Forearm muscle weakness is a probable sign of radial nerve injury caused by crutch pressure in the axillae, right? That is part of reduction of risk potential. Hey, that means I have to educate my patient on how to properly place my crutches so they don't continue to have nerve damage, which is now affecting their forearms. Okay, that is how the categories are. Understand what they're asking you. Be like, man, that's part of reduction of risk potential. Some type just like that. Okay, so think about that as you guys are answering your questions. Remember, you need content, you need Q&A, right? And then you also need your rationales, okay? Let me start answering. Come on, Marco. You got to start. Hey, come on. Participation is the key, baby. Hey, real quick. I have an NCLEX victory guide. It's over 700 pages. I'm going to tell you right now, the path to conquering the NCLEX begins with you. It's not about your teachers. It's not about nobody else, because your teachers just tell you to read the whole book. But I'm telling you right now, it all begins with you. You guys can check it out at that website right there, which is thebootnurse.com/victory, or you guys can check it out in the link in my bio. You guys can go over there and check that out. All right, let's do this. We on it. Here we go. Question number 11. Which of the following statements should the nurse teach the neutropenic client and his family to avoid? Is it avoid oral hygiene after every meal, using suppositories or enemas, performing perinatal hygiene after each bowel movement, or using a filtered mask? What are we thinking? It says, how long have you been a nurse and what is your favorite specialty? I've been a nurse for 3.5 years. I've worked in the burn ICU, a medical ICU, and I floated to a neuro. I floated to med surg a few times. I've worked also PACU, and I worked in the OR. My favorite area was the PACU. I've also been in the Navy, the United States Navy, for 16 years. So, downward slope from here. So that's a little bit about me. Of course, I want to know a little bit about you and where you are from and where you are at in your nursing journey. And if you're not a nurse or whatever, I saw a med student pop up in here. Let me know. Let me know a little bit about you. What are we thinking? 10 more seconds. Thank you for your service. Valerie, appreciate your support. Thank you. Anyone from Honduras? Appreciate the follows, everybody. Thank you for your service. Appreciate your support, Ashley. Appreciate everybody that says that. Appreciate your support on that. No, yeah, there we go. All right, y'all, here we go. Here's our answer. In 3, 2. Jordan says, just graduated school 2 weeks ago, taking the NCLEX. Shout out to you. How do you recommend, hold on real quick. How do you recommend preparing for Kaplan? I hate it so much. I actually love Kaplan. And honestly, I'll tell you, just follow their phases. But here we go. And the answer is B. Using suppositories or enemas. Neutropenic patients or clients are at risk for infection, especially bacterial infections from the gastrointestinal and respiratory tract. An incorrectly administered enema can damage tissue in your rectum or colon, can cause bowel perforation, and if the device is not sterile, an infection. That is part of health promotions and maintenance, right? Health promotions and maintenance. Sorry, somebody just rang my doorbell. I was like, who the hell is at my door? Yes, health promotions and maintenance, 6 to 12% on the NCLEX. Smaller section, but very important. It is part of the 8 sections of the client needs within the NCLEX test plan. Okay, so shout out to all of y'all. I am a BS in Corman, worked as a surge tech, worked as a sterile processor educator. Shout out to you, Marco. Marco, if you didn't know this, I've been in the Navy for 16 years. I am also a hospital corpsman. I was also a surge tech, and I was a surge tech instructor. So I was a surge tech instructor from 2015 to 2018, and I've been an instructor since then. So almost 9 years. But here we go. Question number 12. A female client is experiencing a painful and rigid abdomen and is diagnosed with a perforated peptic ulcer. A surgery has been scheduled and a nasogastric tube is inserted. The nurse should place the client before surgery in what? Is it Sims position, supine, semi-Fowler's, or dorsal recumbent? What are we thinking? Everybody's screaming C. Future RN 24 says C. Your mom says C. 6 months left of my RN program, going into MedSurg 2. Shout out to you, Miss. Is it Misty? Was it Misty? Misty. There we go. Dominique says C. Okay. All right. Shout out to you. All right. Yes. I see you, girl. I see you, Misty. I see you out there. All right. Here we go. First day of nursing school tomorrow. Shout out to you. Hey, good luck to you. Best of luck to you. You're about to get humbled real quick. Penning 10 or first or 110. You mean 24? 23 is already gone. That would have been last year. Here we go. Here's our answer. In 3, 2. And the answer is C, semi-Fowler's position. Semi-Fowler's position will localize the spilling stomach content in the lower part of the abdominal cavity. Initiation of fluid resuscitation should start as soon as the diagnosis is made. Insertion of a nasogastric tube to decompress the stomach and a Foley catheter to monitor urine output are essential steps. That is part of physiological adaptation. 11 to 17%. 11 Sims is wild, ain't it though? But 11 to 17%. I'm so proud of you all. I'm proud of them too. I'm proud of all y'all that are out here participating. All right. 11 to 17%. Third largest section on the NCLEX exam. Okay. I'm so excited I can't get 2020. Hey, get it out your head. It's gone. It's in the past now, baby girl. It's in the past. All right. Here we go. Question number 13. Which nursing intervention ensures adequate ventilating exchange after surgery? All right. So do we want to remove air only when the client is fully conscious? Assess for hypoventilation by auscultating the lungs. Position client laterally with the neck extended, or maintain humidified oxygen via nasal cannula. What are we thinking? Nika says, take my NCLEX Friday, second attempt. That's what I'm talking about. Hey, delayed, never denied. Delayed, never denied. Got A's, we got B's, we got D's. Throw some D's on it. Shout out to all 200 plus of you guys in here rocking with me. Usually it does take some time for the real folks to leave, or for the real folks to stay and the fake ones to leave. So I appreciate everybody sticking and rocking with me. We're doing nursing questions. Got them off nurseslabs.com for RNs and LPNs. So make sure you guys go over there and check that out for yourself. Okay. Also, if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what you doing here rocking with us? Question. And our answer for that question is C. Position client laterally with the neck extended. Positioning the client laterally with the neck extended does not obstruct the airway, so that drainage of secretions and oxygen and carbon dioxide exchange can't occur. That is part of physiological adaptation. Third largest section on the NCLEX, 11 to 17%. Shout out to, Columbus, Mississippi? Columbus, Mississippi. Is it Shanta? Shout out to you, Miss Ma'am. Shout out to you. But yeah, 11 to 17%, y'all. 11 to 17%. So remember, you need content, you need Q&A, you need your rationales. Okay. Here we go. Question number 14. Is this for medical assistant? That's what I'm in school for. No, this is for nurses. Is it Zariah? It's for nurses. But hey, there's nothing wrong with you getting a little bit of knowledge up in here. And trust me, got to think that the nurses teach medical assistants. All right. So there's nothing wrong with you being up here getting a little bit of knowledge, even though you're a medical assistant. All right. Here we go. Question 14. George, who has undergone thoracic surgery, has a chest tube inserted with to a water seal drainage system attached to suction. Presence of excessive bubbling is identified in the water seal chamber. The nurse should what? Strip the chest tube catheter to check the system for air leaks, recognize the system is functioning correctly, or decrease the amount of suction pressure. What are we thinking? Alonda, what is in? Alondra, I'm sorry. You said B? Oh, okay. I'm like, ma'am, that ain't it. That ain't the right one. Got B. Everybody screaming B. Follow me, stop playing. I got you, Alondra. I got you. B, keyword excessive. Okay. All right. And make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. We're on the road to 30,000 likes. On the road to 30,000 likes. Get carpal tunnel for me right now. Make it happen. All right, y'all. Here we go. Here's our answer in 4, 3, 2. And the answer is B. Check the system for air leaks. Just like you said, excessive bubbling indicates an air leak, which must be eliminated to permit lung expansion. Know the location of the air leak by clamping thoracic catheter just distal to exit from the chest. That is part of reduction of risk potential, right? Smaller section on the NCLEX, 9 to 15% actually. Carpal tunnel. Did I say carpal tunnel? Yeah, I did say carpal tunnel because that's what I want. You've done questions similar before. I have. Hey, so like some of these questions will get recycled. That's just kind of how it goes, right? So, all right, reduction of risk potential, like I said, 9 to 15% on the NCLEX, okay? Here we go. Question number 15. A client who has been diagnosed with hypertension is being taught to restrict intake of sodium. The nurse would know that the teachings are effective if the client states what? I can eat celery sticks and carrots. I can eat boiled scallops. I can eat shredded wheat cereal, or I can eat spaghetti on rye bread. What are we thinking? Follow me, stop playing. You follow me and stop playing. What you think this is? Shout out to all 180 you guys in here rocking with me. Hey, I got these questions off nurseslabs.com. Nurseslabs.com. Free sets of questions. Go over there and check them out. Both for RNs and LPNs. RNs and LPNs. Oh, okay. I got you. I got follow me and stop playing. I got you. That you follow me and now you stop playing. All right, y'all. 15 seconds. You over there catching carpal tunnel. Ma'am, I appreciate you. Yeah, I just want to let you know. Dominique, appreciate the heart. Thank you. And yeah, appreciate the heart. Thank you so much. All right, y'all, here we go. Joy says B. All right, here we go. A, but that is too easy. Maybe it's B. Is it Elise? Elise. Hey, sometimes it might be that easy. So if you go with your gut is 9 times out of 10 is the correct answer. But let's see what the answer is. So here's our answer. And the answer is C. I can eat shredded wheat cereal. Wheat cereal has a low sodium content. Sodium controls fluid balance in the body and maintains blood volume and blood pressure. Eating too much sodium may raise blood pressure and cause fluid retention, which could lead to swelling of the legs and feet and other health issues. That is part of health promotions and maintenance. 6 to 12% on the NCLEX, right? 6 to 12% on the NCLEX. All right. And that's what part of the 8 sections of the client needs from the NCLEX test plan. Hey, content, Q&A, rationales. All right. NCLEX on Friday. I want to throw up Miss Ariel. Hey, don't throw up. Don't throw up on me. Hey, real quick. I have an NCLEX course, y'all. It's called the 7-day NCLEX course. I have a new generation NCLEX review where I go over 100 questions. It's like total of like 4 hours worth of content. On top of I'm dropping content in there as well. I have 18 videos inside in regards to like my pharmacology section where we break stuff down. Hey, y'all go over there. Y'all check it out. bootnurse.com/special. And that link is also in my bio. All right, here we go. Question number 16. A male client with a history of cirrhosis and alcoholism is admitted with severe dyspnea resulting from ascites. The nurse should be aware that the ascites is most likely the result of increased what? Increased what? Pressure in the portal vein, production of serum albumin, secretion of bile salts, or interstitial osmotic pressure. What are we thinking? What are we thinking, y'all? Hey, shout out to all y'all that are in here rocking with me. Appreciate you. Appreciate you. You guys, make sure you guys like, share, follow. Hey, we're on the road to 30,000 likes. I got people that are text messaging me right now, seeing what's going on. We got some D's, we got some B's. Got D, got B. Okay. Michaela says C. Okay. Maya says A. Joy says B. Okay, well, let's see what the answer is. Here we go. Let's see what the answer is. Here we go. And 3, 2. And the answer is A. Pressure in the portal vein. In large cirrhotic liver impinges the portal system, causing increased hydrostatic pressure resulting in ascites. Portal pressure increases above a critical threshold and circulating nitric oxide level increase, leading to vasodilation. As the state of vasodilation becomes worse, the plasma levels of vasoconstrictor sodium retentive hormones elevate, renal functions decline, and ascitic fluid forms, resulting in hepatic decompensation. All right, that is part of physiological adaptation. Third largest section on the NCLEX at 11 and 17%. I know that was a mouthful, but trust and believe me, if you ever have the question about your rationales, ain't nothing a little bit more research that you can do for yourself. All right, ain't nothing that a quick Google search won't show you. You know what I mean? So shout out to you. Is it Denisha? Shout out to you for getting it right. Esophageal ascites, or no, varices. I'm sorry, ascites. But shout out to you, Denisha, for getting that right. Here we go. Question number 17. A newly admitted client diagnosed with Hodgkin's disease undergoes an excisional cervical lymph node biopsy under local anesthesia. What does the nurse assess first after the procedure? Is it vital signs, incision site, airway, or level of consciousness? What are we thinking? All right. Think about it. What's the very first thing that I want to do for somebody who just got finished with a procedure? There we go. There we go. It's either A or C. Oh my God, I don't know. Ma'am, give me one. You got to give me one. Pender says C, C, C. All right, I got you. You got to give me one. Make a decision and run with it. A good decision now while you practice is good rather than trying to make a great decision later. All right. I'm going to give y'all 10 more seconds. Hey, if you guys are just now joining, we got to 30,000 likes. I appreciate y'all. Make sure you guys keep sharing. Make sure you guys like. Make sure you guys follow. It's a trifecta. We had 1,000 people up in here earlier, but I think I made some people mad. So I think I made some people mad, 2024. Sounds like a them problem, not a Kevin problem. You know what I mean? But I appreciate everybody being here. But here's our answer in 3, 2. And the answer is C. It is airway. Assessing for an open airway is the priority. The procedure involves the neck. The anesthesia may have affected the swallowing reflex, or the inflammation may have closed in on the airway, leading to ineffective air exchange. When the numbness wears off, the throat may feel scratchy for several days. After the test, the cough reflex will return within 1 to 2 hours. Then the client may eat and drink normally. That is part of management of care, which is the largest section on the NCLEX at 11. Oh my God, at 18 to 23%. How often do I do these lives? I do them every Monday, Wednesday, Friday at 5:30. All right, but management of care is by far the largest section on the NCLEX. That includes delegation, assignment, supervision, who do you see first type. All right, this is fun. I'm playing like it's Jeopardy. Shout out to you, Mads. All right, here we go. Question number 18. A client has 15% blood loss. Which of the following nursing assessment findings indicates hypovolemic shock? Is it a systolic blood pressure of less than 90 millimeters of mercury? Is it a pupils unequally dilated, respiratory rate of 4, or a pulse rate of less than 60 beats per minute? What are we thinking? Some people will come in here and say, oh my God, these are easy. Hey, if they were easy, then people wouldn't get them wrong. And if they were easy, then maybe these questions wouldn't be on here. So think about it that way. All right. Remember, let's look at the stem of the question. What is it asking you, right? What is it asking you? What is a finding that will show you that a patient is in hypovolemic shock? What does hypo mean? Think about it. What does hypo mean? What does volemic mean? Put them together and we take it back to simple medical terminology, right? So Jordan says low, right? Volemic meaning what? Yeah, uh-oh situation. They're all uh-oh situation, but which one? Which hypotension, hypovolume? So we're talking about low volume. Which one of those represent low volume? So as it says, which one of those would indicate that somebody has, hypovolemic shock? Okay, I'm gonna give you guys a little bit more time. A little bit more time. The pulse rate increases. All right, here we go. Here's our answer in 3, 2. And the answer is A. Systolic blood pressure less than 90 millimeters of mercury. Typical signs and symptoms of hypovolemic shock include systolic blood pressure of less than 90 millimeters of mercury. The first change in vital signs seen in hypovolemic shock include an increase in diastolic pressure with narrow pulse pressures. As volume status continues to decrease, systolic blood pressure drops. As a result, oxygen delivery to vital organs is unable to meet oxygen demand. That is part of physiological adaptation. Physiological adaptation, third largest section on the NCLEX at 11 to 17%. Shout out to you, Ariel, for getting that right. So that's what I'm saying. Understand what the question is asking you. All right. Sometimes I didn't ask you anything about like, hey, that person's having surgery. They had surgery in the neck. What's the very first thing I want to look for? Granted, yes, it's airway, but I was specifically talking about hypovolemic, right? What is one of the signs and symptoms of somebody who has hypovolemic shock? What's going to show you first, okay? Woo, child, I know that's right. All right, it says, let me sign up for nursing school ASAP. I think I can do this. Do you, boo? If you can do it, you can do it. Here we go. Question 19. Nurse Lucy is planning to give preoperative teaching to a client who will be undergoing rhinoplasty. Which of the following should be included? Results of the surgery will be immediately noticeable postoperatively. Normal saline nose drops will need to be administered preoperatively after surgery. Nasal packing will be in place for 8 to 10 days. Or is it D, aspirin containing medication should not be taken 14 days before surgery? What are we thinking? What are we thinking? Shout out to all 130 you guys in here rocking with me. We're doing NCLEX questions. Got them off nurseslabs.com. Hey, we're on the road to 40,000 likes, y'all. 40,000 likes. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. That's the trifecta that TikTok needs. Mostly that I need so I can get out there to folks. You know what I'm saying? Hey, I'm trying to get to 100,000 likes. I'm trying to get to 100,000 likes. You know what I'm saying? Thank you for the cap. I appreciate you. The TikTok cap. Yes, ma'am. Thank you. It's Renee, right? It's Renee. If I remember you saying that right. Preoperative. There you go. Preoperative. All right, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is D. Aspirin containing medication should not be taken 14 days before surgery. It should not be taken before surgery to decrease the risk of bleeding. Right? Impaired coagulation may cause post-operative complications. Patients should be asked about history of excessive bruising or bleeding, consumption of drugs, supplements, or vitamins that alter coagulation cascade, or history of thrombotic events in the past. Any drug, vitamin, or supplement that may impair coagulation might have to be suspended preoperatively. That is reduction of risk potential. You got to think, if I'm doing a surgery on you and I'm cutting into you and I have aspirin, which prevents you from clotting, right? And if I cut into you, your body's not going to be able to clot, right? So I have to tell my patient, you need to stop taking it within 14 days so your body can regulate its clotting cascade. So that way it can clot like it's supposed to with that specific surgery, okay? Remember, reduction of risk potential, 9 to 15% on the NCLEX, okay? Here we go. Impaired clotting factor. There you go. Here we go. Question number 20. Paul is admitted to the hospital due to metabolic acidosis due to diabetic ketoacidosis. The nurse prepares which of the following medications as an initial treatment for this problem? Is it regular insulin, potassium, sodium bicarbonate, or calcium gluconate? What are we thinking? What are we thinking? Okay. All right. Think about it. Think about it. Think about it. DKA. So what is somebody going to look like? Like, as a matter of fact, right now, I want everybody to start naming out signs and symptoms of somebody that would display having DKA. You drinking Red Bull? Nah, bro. I'm like this, Trey. I'm like this every single live, bro. Fluids. There you go. Lethargic. There you go. Ketone breath. Sweet. Okay. Polyuria. Yep. Fruit breath. Okay. All right. So is my patient, they're going to have a high ketones. They're going to have a high glucose, right? High blood sugar. There you go, Bethany. Okay. All right. Okay. So they're going to have eventually, they're going to have diaphoresis. They're going to look drunk and shock, right? So think about it. If I'm going to start to have a high glucose, what's going to start to happen to my blood vessels? They're going to start to constrict. So what else am I going to need to do as well? Somebody already said I would want to pump them full of fluids, right? But then also, what is really high with somebody who has DKA? Hydrate, yeah, but what electrolyte is really, really high when you're doing DKA or when somebody who has DKA? Potassium, right? So obviously B is not something I would pick, right? Because if I gave somebody potassium, all it's going to do is increase their potassium, which is going to cause them to keep having heart problems, right? So this is how you eliminate it. That's how you eliminate it, okay? But hey, I'm going to go on to the answer. Here we go. In 3, 2. And the answer is regular insulin. Metabolic acidosis as anaerobic metabolism caused by lack of ability of the body to use circulating glucose. Administration of insulin corrects this problem. The discovery of insulin, along with the antibiotics, has led to drastic decreases in mortality of DKA down to 1%. IV insulin by continuous infusion is the standard of care. Previous treatment protocols have recommended the administration of an initial bolus followed by the infusion of the potassium in 0.1 unit. That's physiological adaptation. Yeah, keyword is initial. So when you guys think about DKA, think about they have dehydration, they have ketones, they have a high potassium, right? And so I need to be able to undehydrate them by giving them fluids. I need to give them insulin to push the K out of the vascular space, right? Oh, and then the other K is K-exalate, because K-exalate is going to push potassium out through your gastrointestinal tract. All right, think about that. It's I have gone against gut feelings and I missed some. See, that's what I'm trying to tell you. Don't go against your gut feeling. All right. So think about that. Physiological adaptation, 11 to 17%. Okay. It says, I was going to say K-exalate. There you go. The Lupihenolene, Lasix, decreased potassium as well. But if I give somebody Lasix, if they're well hydrated, you can give them Lasix, right? If they're well hydrated, you can give them Lasix for sure, right? But if they're already dehydrated, it's like you're gonna be playing a balancing game at that point. I mean, also Lasix is also helps to decrease the potassium as well. Real quick, ladies and gentlemen, this young lady right here is Helen. She is actually one of the people who I actually helped just recently. She passed her NCLEX with one-on-one tutoring and coaching. She passed it in 30 days. She worked the whole month of October, took hers at the beginning of November. You guys can go check that out at my YouTube, or you guys can check that video out in the link in my bio. Awesome job by this young lady by being coachable and also putting in the work, because in the end of the day, that's exactly what you have to do. All right. So here we go. Question number 21. Dr. Marquez tells a client that an increased intake of food that are rich in vitamin E and beta carotene are important for healthier skin. The nurse teaches the client that excellent food sources of both of these substances are what? Is it fish and fruit jam? Is it oranges and grapefruit, carrots and potatoes, or spinach and mangoes? I'm a big fan of some mangoes. I like mangoes. You know what I'm saying? But shout out to all y'all. What are we thinking? Hey, we're on the road to 40,000 likes. I appreciate everybody smashing those likes. Hey, I need 100 shares. Hey, get me to 100 shares. Let TikTok know we out here. We ain't playing no games in 2024. This is how we do. All right. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what you doing here hanging out with us? I saw some med students in here. How do I get a one-on-one, Kev? Nika, if you're looking to do a one-on-one, you can check that link out. It's in my bio. It's labeled NCLEX one-on-one coaching. And everybody's situation is different. I get asked about the price all the time. So it's just everybody's situation is different. So I'm about to take the NCLEX. Shout out to you. Take my NCLEX on Wednesday. Shout out to you. And I better not see you until Friday then. All right. I'm just saying. Here we go, y'all. Here's our answer in 3, 2. And the answer is spinach and mangoes. Beta carotene and vitamin E are antioxidants which help to inhibit oxidation. Vitamin E is found in the following foods: wheat germ, corn, nuts, seeds, olives, spinach, asparagus, and other green leafy vegetables. Food sources of beta carotene include dark green vegetables, carrots, mangoes, and tomatoes. Tomatoes, all right, health promotion and maintenance, all right, smaller section on the NCLEX, also 6 to 12%, all right. That's really kind of you. Hey, this is what I do. I don't know how to say your name. Is it Posh? Is it Posmoy? What's your real name? That way, I'm going to butcher that, all right? But hey, shout out to everybody that got this question right, okay? But here we go. Question 22. It says 1 year left in my RN program from Cincy, Ohio. Okay, shout out to you from Cincy, Ohio. Question number 22. A client has a gastroesophageal reflux disease or GERD. The nurse should teach the client that after every meal, the client should what? Rest in a sitting position, take a short walk, drink plenty of water, or lie down for 30 minutes. It says, which my instructor was as engaged as you during my program review. Gabby, it's actually really crazy. When I created the 7-day NCLEX course, I created it, it's an on-demand course, but I created it for that exact reason, is for it to give you time to absorb the knowledge rather than you going through a 3-day NCLEX course or any type of course and you feel so rushed, you know? Like I've done many 3-day NCLEX courses and I left with headaches. So not saying that I didn't acquire all the knowledge, but it was just like, man, I wish it would have been a lot longer. I just passed my licensing exam from Jamaica, and now I'm planning to do the NCLEX. Shout out to you, gentles. Here we go. Here is our answer in 3, 2. And the answer is A, resting in a sitting position. Gravity speeds up digestion and prevents reflux of stomach contents into the esophagus. Instruct to remain in an upright position at least 2 hours after meals, avoiding eating 3 hours before bedtime. Helps control reflux and causes less irritation from reflux action in the esophagus. That is health promotions and maintenance. All right, health promotions and maintenance. All right, sorry if that's a little fuzzy, guys, but I'm trying to make sure everybody can see that. All right, here we go. Shout out to everybody that got that answer right. It is resting in a sitting position. All right, here we go. Question number 23. After gastroscopy, an adaptation that indicates major complications would be what? Is it nausea and vomiting, abdominal distension, increased GI motility, or difficulty in swallowing? What are we thinking? Zay says B. Okay, shout out to you. Shout out to everybody that's still rocking with me. I got these questions off nurseslabs.com. They are free sets of questions, both for RNs and LPNs. You guys can go over there and check those out for yourself. Also, make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. Hey, give me the 40,000 likes. Hey, that's like less than 4,000. You know what I'm saying? Another little tidbit about me, if you guys are new here. I failed my NCLEX 3 times, y'all. I failed it 3 times, and I passed it on my 4th attempt. I even made a YouTube video about it. You guys can go over to my YouTube and check that out. That is linked in my bio. And I'm telling you right now, like, there's nothing better than talking to somebody who was unsuccessful at their NCLEX to still be here putting in that work. Trust and believe me, because no one's going to do it except for you. You know what I'm saying? Ma'am, I'm all about the transparency. I gain nothing from lying to nobody. I promise you that. All right, here we go, y'all. Here we go. Here's our answer. In 3, 2. And the answer is B, abdominal distension. Abdominal distension may be associated with pain, may indicate perforation and complication that can lead to peritonitis. Bowel perforation occurs in less than 0.3% of cases, and infection is rarely reported. That is part of reduction of risk potential. All right, reduction of risk potential, which is 9 to 15% on the NCLEX. Very important portion of the 8 sections of the client needs on the NCLEX test plan. Okay, remember, you need content, you need Q&A, and you also need your rationales. That's what you need. I don't like if some people tell me, hey, should I just get questions or should I buy a whole thing? Me, I'll tell you to buy the whole thing, because it's better to have it. It's better to have it and not need it rather than need it and not have it and try to, save yourself a little bit of money somewhere. You know what I mean? But that's just me. That's just what I say. But haven't the rules changed in 2024? Gabby, no rules have changed. The rules changed April 1st of 2023. And what rules are you talking about? What rules are you talking about? And all of the information that I'm giving you right now is based off of the April 1st, 2023 updates in regards to both NCLEX for RNs and LPNs. Okay. Question 24. A client who has undergone a cholecystectomy asked the nurse whether there are any dietary restrictions that must be followed. Nurse Hillary would recognize that the dietary teaching was well understood when the client tells a family member that what? Most people need to have a high protein diet for 12 months after surgery. I should not eat those foods that upset me before the surgery. I should avoid fatty foods as long as I live. Most people can tolerate regular diet after this type of surgery. What are we thinking? Is it Maymu? Maymu says C. Okay. Ariel says D. Okay. Hey, so by the way, if I have anybody that's an LPN, that's a patient care tech, that's a medical assistant, or X-ray, OT, RT, hey, shout out to all y'all. I appreciate y'all. I love y'all. Like, y'all don't get enough love. Y'all don't get enough shout outs because people really be out here being real disrespectful. So if anything, hey, we're going to start 2024 off right. And I'm going to tell y'all I appreciate y'all. And I love all the work that you guys do. But we all got to love, hey, everybody love everybody. You know what I'm saying? Everybody got to love everybody, or else we're not going to be able to get this shit. We're not going to be able to get nothing done. All right. So shout out to all y'all. But here's our answer. Here's our answer in 3, 2. Shout out to my RTs. Hey, I learned everything I ever learned about the vent came from an RT. Everything. And I'm telling you, and it was during COVID. Oh boy. All right. Appreciate you. That's so nice. Keep it kind all the time. You got to keep it kind, because if you, I don't want the negativity around me, which is why when people come over here and start telling me to hurry up, I'm like, you don't even know me. And you're telling me to come to what? Make it make sense. But anyway, so it's D. Most people can tolerate regular diets after this type of surgery. It may take 4 to 6 months to eat anything, but most people can eat anything that they want. It says start with clear liquids after the surgery to prevent nausea, vomiting, and constipation. So like soups, jello, juice, popsicles, and carbonated beverages. Then advance to a regular low-fat diet. Eat smaller meals more often instead of fewer larger meals, which is health promotions and maintenance. All right. I'm a good person. Girl, stop it. I'm just trying to do my thing. Did you grad nurse? Did I grad nurse? What are you talking about? Can you show the question again? Michaela, just like NCLEX, we don't go back. So you just missed it. And that's okay. That's why we call this practice. Nurse Rachel teaches a client who has been recently diagnosed with hepatitis A about untoward signs and symptoms related to hepatitis that may develop. The one that should be reported immediately to the physician is what? Is it restlessness, yellow urine, nausea, or clay-colored stools? I got you. I appreciate you. Here we go. Got you telling me D. Grace, I appreciate you. Grace knows what's up. Grace has been here for quite some time. She knows that we don't go back. All right, what are we thinking? Shout out to all y'all. Hey, appreciate everybody in here jumping. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions for both RNs and LPNs. Make sure you guys smash that like button. I'm trying to get to 40,000 likes. Make sure you guys share and make sure you guys follow. Logan says I passed. You passed what? Stain Girl, what's up? I see you out there. Stain Gal is a regular. All my folks that are regulars out there, I try to give them shout outs because I see them all the time. Welcome to 2024. All right, y'all, here we go. Here's our answer. In 3, 2, and the answer is D. It's clay-colored stool. Clay-colored stools are indicative of hepatic obstruction. Acute HAV infection is typically a self-limiting illness characterized by nausea, vomiting, right upper quadrant abdominal discomfort, malaise, anorexia, myalgia, fatigue, and fever. That is part of physiological adaptation. All right, 11 to 17% on the NCLEX exam. One of the top 3. They make up 44 to 49% of the entire NCLEX exam. Okay, so shout out to everybody that picked clay-colored stool. Remember, if you got this answer wrong, read your rationales and understand why your answer was incorrect, okay? That's the only way that you learn. By the way, check this out. This young lady passed on the 21st. It was her 11th time taking the NCLEX, y'all, and she reached out to me and in order for me to, essentially help her, coach her through NCLEX. This young lady right here who just passed on the 29th of December, that's what, last week, right? Took it on her 6th attempt, y'all. On her 6th attempt, and she passed, y'all. You know what I'm saying? I'm trying to tell y'all that Sometimes guidance is needed. I got it. Other people got it. Mentorship is a big thing, and you always should have it. It doesn't matter where you are in life. So make sure you guys check that out. Anybody interested and need coaching on or guidance on how to conquer the NCLEX, check me out. It's over there at thebootnurse.com/coaching. But shout out to those two. One took it 11 times and is from Ohio, by the way. And then the other one is in California and took it on her 6th time. You know what I'm saying? It's hard, but it's doable. Here we go. Question 26. Which of the following tuberculosis drugs can damage the 8th cranial nerve? Is it INH? Is it PAS? Is it myopatol, or is it streptomycin? What are we thinking? What are we thinking? Shout out to all 112 of you guys in here rocking with me. I appreciate everybody pretty much holding out to the end. Pretty much holding out. We almost there. We almost there. Shout out to everybody in here rocking with me. Also, another little thing about me, if you guys don't know that, I've been in the Navy for 16 years. Out of those 16 years, I've worked as a LPN, which is essentially we're a hospital corpsman, but we do things that LPNs do. I've been a surgical tech. and I'm also a master instructor in the Navy. So I've been teaching for the last it'll be 9 years next week. So shout out to everybody that's in here. I love teaching. I love doing this. I tried to go get jobs, like in schools, and they don't want me. So, whatever. Here we go. Here's our answer. In 3, 2. And the answer is D. It's streptomycin. All right. It's streptomycin. Streptomycin is an aminoglycoside, and damage to the 8th cranial nerve is a common side effect of aminoglycoside, right? Because glycosides can cause ototoxicity. Ototoxicity and vestibular impairment are often thought to be the hallmark of streptomycin toxicity. In extreme cases, deafness may occur due to ototoxicity. Thus, caution must be exercised by combining streptomycin with other potential ototoxic drugs. That is part of pharmacological and parenteral therapies, which is the 2nd largest section on the NCLEX at 14 to 18% or 13 to 19%. Either way, still the 2nd largest section on the NCLEX. Michaela, yeah, mycin. Think of like a mean old mycin, right? Hey, shout out to, who can guess where I got that from? A mean old mycin. All right. So shout out to everybody that got, there you go, Grace. You already know what the deal is. All right. So shout out to everybody that got that one right. Hey, remember, this is how you learn. This is how you retain. Shout out to Mark K. All right. Here we go. Question number 27. The client asked Nurse Annie the causes of peptic ulcer. Nurse Annie responds that recent research indicates that peptic ulcers are the result of which of the following? Is it genetic defect in gastric mucosa, stress, diets high in fat, or is it the H. pyloric infection? What are we thinking? We got B's, we got C's, we got D's. Throw some D's on it. All right. Shout out to all y'all. Okay. All right. Most people says D. Okay. All right. I'm going to give y'all 10 more seconds. 10 more seconds. If you guys are new here, welcome. We're doing NCLEX questions both for RNs and LPNs. Shout out to y'all. If you guys also are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. Get carpal tunnel for me. Sorry if you guys hear my son. I swear every time I get on live, he's just like, I'm just going to cry because I know people are going to hear me. All right, y'all, here we go. Here's our answer. In 3, 2, and the answer is D. It's H. pyloric infection. Most peptic ulcers are caused by the H. pyloric, which is a gram-negative bacterium. H. pylori is a gram-negative bacillus that is found within the gastric epithelial cells. That is part of physiological adaptation. Physiological adaptation, which is what? The 3rd largest section on the NCLEX at 11 to 17%. Right? Remember, management of care, pharmacological and parenteral therapies, and physiological adaptation make 44 to 49% of the entire NCLEX exam. All right. So make sure, ladies and gentlemen, that you guys understand your content, applying it to your Q&A, and then reading your rationales. All right. Reading your rationales, whether you got it right or whether you got it wrong. Okay. Here we go. Question number 27. Ryan has undergone a subtotal gastrectomy. The nurse should expect the nasogastric tube drainage will be what color after about 12 to 24 hours after surgery? Is it going to be bile green, bright red, cloudy white, or dark brown? What are we thinking? Detroit, first semester RN, taking fundamentals in a couple of weeks. Is it Joy? Shout out to you, Joy. Hey, be ready. Be ready. First semester of nursing school is what I like to call the humbling stage because it humbles everybody. Your first 2 semesters of nursing school are usually humbling and the weed out. That's what they call it. They weed out people that don't belong there. Or essentially, if you can't hack it, they're gonna find out real quick if you can't hack it or not. GG says A. Is it Rava? Or is it Riva? Says A. Nika says B. Shout out to y'all. This is good to know. I like your insight. Oh, you're welcome. I got you. 2024 is going to be a good year, y'all. It's going to be a good year. Yes, last semester was cool, but I heard the second is a do or die. Hey, that's how they do you. But here we go. Here's our answer in 3, 2, and the answer is D. It is dark brown. 12 to 24 hours after subtotal gastrectomy, gastric drainage is normally brown, which indicates digested food. Assess color, amount, and odor of gastric drainage, noting any changes in these parameters or the presence of clots or bright bleeding, right? That's part of physiological adaptation, of course. Third largest section on the NCLEX at 11 to 17%. All right. Remember, one of the top 3 sections on the NCLEX exam. A lot of people always ask me what I always repeat that. That's because there are people that are coming and going into this chat all the time. So, if it's helpful for them, then, it works, So old blood and bile. There you go. Here we go. On to the next one. Question number 29. Nurse Joan. Joan seems like kind of an old name, but, shout out to anybody whose name is Joan, is assigned to come for a client who has just undergone eye surgery. Nurse Joan plans to teach the client activities that are permitted during the post-operative period. Which of the following is best recommended for the client? Is it watching the circus, bending over, watching TV, or lifting objects? What are we thinking? Who told me that they just passed their NCLEX? Somebody just told me they passed their NCLEX? Hold up. I got to scroll up. It says, hello, Kevin. Thank you for your help. Finally passed my NCLEX. Got my official results this morning. Yes, ma'am. That's what I'm talking about. Hey, right now, everybody needs, is it Chacho? Everybody needs to go look at Chacho. You guys need to give her flowers. Tell her congratulations. Welcome to the greatest shit show on earth known as nursing. Doesn't matter if it's RN or LPN. Congratulations to you, ma'am. I know we were going back and forth and you were telling me how you were having some difficulty. So I'm so glad and very happy that you were able to finally conquer that aspect of your journey. If you could give a piece of advice to anybody that's about to embark on that said endeavor, as in the NCLEX, what advice would you give them? I guess watching the circus. I don't know. I didn't make the question, but here we go. But the answer is C, is watching TV. Watching TV is permissible because the eye does not need to move rapidly with this activity, and it does not increase intraocular pressure. That's part of physiological adaptation, which is, of course, the third largest section on the NCLEX at 11 to 17%. Okay, 11 to 17%. So remember those things. I hope by the time you guys go and take the exam, you guys will hear it. You'll be like, oh, Kevin said that's the third largest section. Oh, it's in my head. Yep, there it is. All right, here we go. Question number 30. A client suffered from a lower leg injury and seeks treatment in the emergency room. This is a prominent deformity to the lower aspect of the leg, and the injured leg appears shorter than the other leg. The affected leg is painful, swollen, and begins to become ecchymotic. The nurse interprets that the client is experiencing what? A fracture, a strain, a sprain, or a contusion. What are we looking at? What are we looking at? Oh, I'm looking to see that advice. Where that advice at? Did she not put it in here? You meant A? Okay. All right, cool. All right. Chacho, where'd you go? Did you drop advice? Did I miss it? Shout out to all y'all that are in here rocking with me. I appreciate you guys. As a matter of fact, I appreciate you guys just participating, you guys being here. Hey, remember, I do this for y'all. I do this for y'all. It doesn't matter if there's one person in here, I would still do this for y'all. You know what I'm saying? I got to provide value to y'all because I wish I would have had something like this when I was in school. Better yet, I wish I would have even known if anybody did it, but I didn't know of anybody that did it. So I just took it upon myself and, want to give back. So that's what I like to do. I appreciate everybody being here. I'll give you guys 10 more seconds. 10 more seconds. God bless you. Delisha, don't be crying over there. We appreciate your effort. I appreciate y'all being here. I really do thoroughly enjoy doing this. I'm actually going to start doing stuff off of TikTok because what that'll do, that actually filters out the people that actually want to be there rather than people coming in here and telling me what I need to do and what I don't need to do. Because I think that's just kind of funny. Gabby said, I'm glad I found you. Gabby, I'm glad you're here. I'm glad you found me too. But here's our answer in 3, 2. It says, I wish you did this for NBS TSA. You know what, Melissa? What's funny is that I actually used to teach a CST course for search techs when I was a search tech instructor. So I don't do it anymore. I think I have a buddy that might do it. I'll find out though. But anyways, the answer is A. It is a fracture. Common signs and symptoms of fractures include pain, deformity, shortening of the extremity, crepitus, and swelling. These injuries are associated with symptoms of pain, deformity, swelling, and a wound that may be bleeding. It should be noted that the wound may not lie directly over the fracture site. The movement and neurovascular status of all involved limbs should be assessed to ascertain whether or not there is a possible nerve or vascular injury associated with the fracture. That is part of physiological adaptation. Shout out to give me 40,000 likes. I appreciate you. Physiological adaptation, 11 to 17% on the NCLEX exam. Third largest section on the NCLEX. Make sure you guys pay attention. By the time you guys start studying, you guys are going to be able to be like, okay, I know what section that falls under when it comes to the NCLEX test plan. All right. And ladies and gentlemen, that is a wrap on our very first set of NCLEX questions for 2024. First of all, I appreciate everybody hanging out and participating with me. I appreciate all the love, all the likes. Y'all got me to 40,000 likes. At one point, we had over 1,100 people up in here. So y'all already know the deal. I appreciate y'all. Hey, so by the way, a lot of people ask me what a 600 is. And a 600 is just me banning you. So you'll hear me say 600, or I'll just say I'm going to ban that ass. I had people come in here and tell me to hurry up or stop yapping. So I banned like 5 people. I don't remember their names because they're unimportant. Just letting you know. Once again, I got these questions off nurseslabs.com. Nurses, more than one. Labs, more than one. Put them together. Nurseslabs.com. Free sets of questions. You guys go over there and check those out for yourself. Also, I have an NCLEX course, 7-day NCLEX course. The reason why it's 7 days, it's first of all, it's on demand. But the reason why it's 7 days is I would rather you absorb the knowledge 1 day a week for 7 days from an hour to 3 hours than me try to cram all types of information over a weekend. I feel like that's not conducive for learning. So, but anyways, you guys got that over there. You guys can check that out. It's $97 for a lifetime and you get all the updates. So if you pass away, you could pass it down to your descendants, ancestors be willing. You guys could check that out. Also, free download over there. Check that out as well. I do tutoring, coaching, the ebook, all that stuff is in my bio, and I'm going to turn this thing around so you guys can see my glorious face, because apparently that's what people, oh my God, what do you look like? Oh my God. And look, this is what I look like. Hideous, baby. What is y'all doing? What are we doing? Hey, happy 2024. Hey, remember, it's not a new you. It's not new year, new me. It's new year, improved me, because we improve from the previous year, even though that was, I don't know, what, 18 hours ago? I don't know. I don't math well. I'm just letting you know that. Sorry, look, I'm dealing with all these allergies that I got going on. I live in San Antonio. If you're in Texas, let me tell you something right now. Hey, I know you are struggling with these allergies right now. I know y'all are struggling. But hey, a little bit about me. My name's Kevin. I've been a nurse for 3.5 years. I've been in the Navy for 16 years. I've worked in ICU, OR, and PACU. I'm going back to school to get my degree in nursing education, my master's in nursing education. So, whenever that happens. So, of course, this is like where I like to do the AMA. So ask me anything. So essentially, whatever question that you guys have that I can answer within reason, I can't answer everything, but I can answer a good thing. Like if you're a pre-nursing student, if you're in nursing school, about to take the NCLEX, new grad stuff, like, how to prepare for that. Hell, even like how to like escape bedside, you can ask me all type of questions. How soon you got your BSN? I went straight to get my BSN. I was active duty in the Navy, and in order for you to be a commissioned officer, you had to have your bachelor's degree in order to even commission. So I got my bachelor's degree in 2018. So I went straight to, I didn't even know, it's funny, I didn't even know you could get your associate's degree as a nurse until I had already had my bachelor's. So thank you for that. That's a lot. You're welcome. You're welcome. Wait, did you ever tell me your name? Because I say Pat, like Passmoy, but that seems weird. What up, Passmoy 833? That's not your God-given name. But yeah, so what other question do you have? What other question y'all got? Shout out to all 65 of you guys here rocking with me. You guys got me to 60 or 41,000 likes. So I appreciate Megan. Oh, okay. I got Megan or Pat. I'm going to go with Megan. I'm gonna go. Megan seems just, a little bit easier. So I appreciate you. But what other questions do you guys have? Like I said, if you guys have any questions about anything, just drop them down in the chat. I'll try to answer them as best as possible. Somebody asked me about merch. If you guys go to my website and you guys click on the apparel, you guys will find shirts over there. They're just basic minimal shirts, whatever you decide to do or not do, it supports me. So I appreciate that. No, thanks, new friend. Oh, okay. I got you, friend. Kevin Hart. You know what I'm saying? So, all right. So what is the deal? Hopefully everybody had a really good New Year's. Everybody was really safe. I didn't really do much. I just chilled. I always like to think of like my years of reflection. So I reflected pretty much all day of how like my year went, how it started, and then how it ended. And I'm pretty proud of that. And you guys should be proud of where you guys started in 2023 and where you guys ended. All right. You got to think perspective. You could not even be here with us. You know what I mean? So it says, I worked in the ER for 15 years. It was a good adventure. I bet it was. Gabby says Monday, Wednesday, Friday. Yes, Monday, Wednesday, Friday, 5:30 Central Standard Time. After the 7-day course, how soon do you recommend taking the NCLEX? So what? It just depends. So like for you, if you're in school right now, you should want to take the NCLEX ASAP, as fast as possible. Now, if you're one of those people who's been out of school for a while, I would recommend 30 days. Right? And that's, of course, where you start doing questions and answers and looking at rationales and all that other good stuff to make sure that you have practiced enough to put yourself in a position to pass it on the first attempt. Okay. Thank you. See you next time. Is it Rosalie? Are you alive? I'm very much alive right here. I'm right here. It's Wendy. Oh, okay. I got you, Wendy. It says what? So, I graduated already and I failed 3 times. Oh, okay. So for you, for somebody who's been out of school for a while and taking the exam multiple times, I honestly think anywhere from 30 to 45 days. For most of the people that I coach with regards to that, like I'll give you an example. Stacy, she's failed like 11 times and I worked with her for about 30 to 45 days and she went in there, she killed it, and she just got her license on the 21st of December. So you graduated last May of 2023. Okay. Well, hey, and also think about it like this. Like if you want one-on-one help, where I help walk you through all kinds of stuff, you can check me out. We can see about getting you some coaching and, accelerate your life, getting you past this pain point that you have. So is it Panacala? How am I pronouncing that? I feel like I'm messing it up. So it just depends because everybody needs something different. Wendy. Oh, Wendy. So your name is Wendy too? Oh man, so I got 2 Wendy's up in here? Is rad tech better or nursing? Gabe, it all just depends. Gabe, I feel like you asked me that question already. I feel like you've asked me that question like in a past life somewhere. But yeah. Gabe, it all just depends. Like you can actually do radiology as a nurse, like working like in the cath lab, or you're actually working in radiology. You can specialize as a nurse. So it all just depends on you. You could go be a rad tech and then enjoy that, then go be a nurse and then go turn around and then get your job, as a nurse working in radiology. You could do that. Did you say to send you a PM for coaching help? I thought you said Nika. So if you are looking for coaching, you can go to the link in my bio and it'll take you to my website. And if you're okay with everything that's labeled out on the website, you have to actually fill out an intake form because, coaching is a relationship. It's not, I don't just coach anybody. But coaching is a relationship. And then we schedule a 15-minute call. You fill out the intake form. We talk and then we see if coaching is actually a good fit for you. Talking about Wendy, it says, yes, I will. I've been on the live. Okay. Appreciate you. Yes. I failed 3 times too. Okay. Oh yeah. Testing soon again. When are you testing, Wendy? 19 weeks to RN. Shout out to you, Miss Marie. Any advice on getting a good score on the NACE for LPN RN? Honestly, it's just study for it. Okay, I take the test Friday. Do you recommend I do that? Wait, you take what test on Friday? You take the NCLEX on Friday? This Wendy, I have not. Oh, okay, I got you. Okay. Oh, you're asking like how to study. Nika, hold on a second. Like it says, okay, I take the test. Okay, so Nika, you take your test, your NCLEX exam on Friday. Honestly, my coaching is at least 30 days. So coaching is honestly wouldn't even be right for you. It wouldn't even be feasible. And if it was feasible, it would require to where we would literally have to meet like every day starting today until Friday. But then again, that's essentially like cramming, and that's not conducive for you. Like that's not even good learning and absorption. You know what I mean? Because it takes time for you to, develop a habit, and I don't know exactly what your habits are. So I would say you don't need, at this moment, you don't need it. I wouldn't recommend you doing coaching with me. Now, if you wanted to just do like a one-on-one call where we sat on the phone and we talked for a little bit about, some things that you can hone in on, we could do that. But if you're looking for like longevity with coaching, like which is usually 30 days for people, I would not recommend that for you at all. This Wendy, I have not scheduled. Okay, Wendy, so you haven't scheduled yet. Wendy Watt. I'm going to say that, Wendy Watt. So for Miss Wendy Watt, I would recommend you check out the coaching, and you haven't scheduled yet. And so you and I, if we work together with the coaching, we would talk about when you would schedule, so on and so forth. And the other Wendy, you take yours on the 19th. I've actually coached people for 2 weeks. Like I coached people for 2 weeks and they wrecked it. It all just depends on you. It says afraid to schedule. I think I need the coaching. Well, go check it out. I've been thinking about rescheduling. All right. So I usually tell people is that you better have a really good reason on telling me why you want to reschedule. When is too soon to study for the NCLEX? Lanisha, that's not even a really, you gotta answer that. Ask that question better. I can't even answer that. Joseph says, take my NCLEX in 9 days. Shout out to you, Joseph. Shout out to you. Keep studying. Hey, the day before you take your NCLEX, don't you study at all. Because at this point, if you don't know if you don't know or familiar with the information the day before the exam, you don't know it at all. Next year, you're going to start cramming. You're going to give yourself a headache. You're already going to be nervous. Don't do that to yourself. So the day before, chill out. Don't drink. Don't get drunk. Don't do anything crazy like that. Just relax. I don't know. Watch anime. Like me. That's what I did. Or play the game. You know what I'm saying? Do something along those lines. Okay. To kind of relax your mind before you go and take your exam. My reason is I'm nervous for my second attempt. You want to know what's crazy when people tell me that you're nervous? Is that when you go take that exam, whether or not you believe it or not, your answers or your score is already set in stone. Once you leave, you're just waiting. So, you're going to be nervous, but you're going to do it scared. Because if you don't do it scared, you won't do it at all. Keep canceling it and keep pushing it back and keep pushing it back. You are only denying the inevitable. You're only denying the inevitable. So go do it. You're going to be scared doing it anyway, so do it. I call that getting off the beach. If anybody knows the reference, that's, let me know if you understand the reference of getting off the beach. How long do you recommend studying part-time? Most people, they can study part-time. I mean, everybody wants me to give them a specific number. Anything from 4 to 6 hours. Does that make you happy? But it all just depends. Like you could ask me, hey, how many hours do you recommend? I don't know your life, Baked Barbie. I don't know your life. I would actually, if I knew everything under the sun, then I would be like, okay, you could probably get a good 4 hours in at this time on this day, so on and so forth. But I mean, if you want a good, umbrella type of answer, yeah, I would say 4 to 6 hours, 4 to 6 hours a day. Would second semester nursing student out of 5 be? No, Lanisha, not really. You really need to start, you can start looking over stuff, but your last semester is where you really got to hit it. 7th attempt in a month. I don't know what to study anymore. Marcel, I think you've told me that. I think you've been in here before. Yeah, Nika, you got to get out of your comfort zone for sure, for real. So your 7th attempt in a month, Marcel, and you say you don't know what to study anymore. I don't think it's necessarily you don't know what to study anymore, rather than understanding the proper way to study and how to incorporate a study calendar and plan that is unique to you. Also, that is also available to you as well, where I talk about coaching. Like I said, the plans are made up differently per person. So like I said, you can go over there, you can check that out. But look, I've coached people on their 7th attempt. I had a young lady just pass on her 6th attempt on the 29th, and I had another young lady who just passed on the 21st on her 11th attempt. So trust me, you are not the only one. Get out of the scandal. What's a scandal? Noah, what's a scandal? You talking about the show Scandal? I've never watched it. That's true. Thank you. I would recommend studying NCLEX now. Do 25 a day. No, don't do 25 a day. How many questions are on your NCLEX? How many questions are on your NCLEX? Hey, this is my first year nursing. Do you have any advice for remembering information on A&P? Honestly, that's all memorization. That's all memorization. It says PME, I want the good news. PME, I want the good news when you pass. Rooster says being a hospital CNA for 6 years helped me major. Yeah, working in the field actually does help. No, there's 85 to 150 questions. So why would you study 25 questions? When you at the bare minimum, you need to be doing 85 questions in one sitting on a running clock and not in tutor mode. It doesn't matter where you get your questions from, but not in tutor mode. 85 questions listen. Why would I study 25 questions when my test is 85 questions in one sitting? Yeah, it's called building endurance. You've been told otherwise? I'm going to tell you right now. No. Messing with me, with my coaching? No. You don't do 25 questions. You do 85 at the bare minimum because we practice like we play. We're practicing to show out, to go watch the Longhorns play today because they play at 7:45 because they play Washington. And Lord have mercy, they better beat them. But what I'm saying, Stephanie, hey, don't spam, don't do that. Don't do that because you're about to get blocked and I'm not even going to answer your question. Don't do that. And to answer your question, it depends on you. I like Archer. I've used UWorld. I wasn't a fan of it, but other people swear by UWorld. All right. So it all just depends on you. Archer is a little bit cheap, a little bit less harsh on the pockets, right? But UWorld is just as great. I mean, it all just depends on you and what you like. All right. I agree with him. I wouldn't run a half marathon if I needed to run. Exactly. Right. So, but yeah, to 85 questions, right? That is how you practice every single time. Both are good. Both are good depending on you. Me, I use UWorld and I didn't like it. But I've used Archer. I think Archer's cool. I use Kaplan. Somebody else on here asked me specifically about Kaplan and I didn't get the chance to answer them. But I liked Kaplan. And I used it. I used Mark Klimek. I had Board Vitals, wasn't a fan. I used Hearst, wasn't a fan. I thought Hearst was okay, but I was not a fan. Which is why I understand how all these other things work, which is why I created my own, right? Kaplan's been around for quite some time too. Would you recommend just using nurses' labs? Some people have. Hell, some people have just come to my lives and listened to me listen to me go through them, and that's all they needed. Now, Wendy, for somebody who has been unsuccessful multiple times, I think there may be a little bit more underlying things that obviously you can't tell me here, but I think there might be some more underlying things that are preventing you from accomplishing your goal of passing. So that's just me though. I don't know you personally. This isn't me to try to get you into coaching. This is just a trend that I've known from other people as well as myself because I failed 3 times. So it says my school uses ATI. How do you feel about it? I don't like ATI. And I don't like HESI. I don't like either one of them. But there's other people that they love them, but I'm just one person. And that's just my opinion because it didn't work for me. Do you know if you can use Kaplan after it's been maybe 2 years? Probably not. I did my exam closed at 89 questions. I didn't pass. I hope I pass on the next one. Hey, so change your verbiage. Don't tell me I hope to pass on the next one. Tell me you will pass on the next one. Tell me that. I did Archer and UWorld. So like I said, I've done a bunch of things and they just didn't work for me until I found a combination of things that worked for me. Okay, I will get with you. Yeah, get with me. Come talk to me. Let's have a conversation. All right. I will. I know that's right. You will pass. Shout out to all 69 of you guys in here rocking with me. Hey, listen, when you come to me with questions, hey, I'm going to be very, very honest. I'm going to be very honest with you in my reply. If it sounds aggressive, I'm sorry. It's a lot of the military in me. And please don't take it as I'm trying to attack you. But what I will do is I'm one of those people. I don't do excuses. I don't do them. I was just like, you're going to come. If this is what you want, this is what you want. A lot of people come to me for the accountability. Like you can ask, there's one young lady I'm coaching right now. I text her every other day. I'm like, hey, where's my stuff? And she's just like, oh, I didn't do it. I'm just like, hey, where's my stuff? And then the next reply is, it's going to get done tonight. Oh, okay, cool. Shout out to you. Not Remar Nurse. Regina's in here. Oh my God. Thank you, Regina, for the flower. I appreciate you. Thank you, Miss Man. Hey, if you guys don't know who Miss Remar is, Miss Remar Nursing, Miss Regina Callion. I always get excited when she comes in here. It's like her second time. Miss Ma'am, I appreciate the follow. I have been unsuccessful twice on my NCLEX. Okay, Maggie. So you got to also, here's another thing that I want for you guys to think of when it comes to studying for your NCLEX. Okay. Here's what I want you to think about. Think about your environment. All right. Think about your environment. What and who is around you. All right. Think about, do you understand NCLEX style questions? Do you understand the content? Thank you, ma'am. I appreciate you. Thank you. I appreciate you. Think about understanding NCLEX style questions. Think about, do you understand content? What is your biggest pain point? Like, is it like me, it was pharmacology and it was maternity. You see what I'm saying? Those were the biggest ones. Those were the biggest headaches for me. So that's where I started, right? How many questions a day do you study? It damn sure better not be 25. You know what I'm saying? Like, how often do you study your questions? What does your study calendar look like? Hey, do you take breaks? Because you have to give this a break. Trust and believe me. Okay. What else? Support system. Do you have one? Believe it or not, the people that are around you that you feel that are the most close to you, so a husband, wife, spouse, whomever, who are negative will be a detriment to how you how you gain anything. So those are the things that we talk about. When people come with me for coaching, these are the things that I ask them. And I'm like, what about it? And if you start having these issues, this is what I say, this is what I call a reevaluation period. You really have to reevaluate what you want, right? And then another thing is, I can't want it more than you. I can't want it more than you. Everybody comes to me and they're just like, well, I want it. Well, how bad do you want it? I want you to want it, but I can't want it more than you. I already have mine. I fought for mine and I made it happen. And what makes you think that you can't accomplish the same thing? And if you're finding value, smash this like button right now, okay? It says the same with me. I graduated in May, starting to prep for NCLEX beginning now. Correct your review on simple nursing. We're talking about my review, Stephanie, on simple nursing. How many hours do you recommend studying? Is it Abdel? Hopefully I said that right. Or Aziz. I'll say Aziz. It all really just depends. It says, Kevin, is it the coaching tab or the 101? It's the coaching tab. So Aziz, you're asking how many hours. So it all really just depends on where you are on your nursing journey. Like if you're in school, or if you have already taken the exam, or if you've already been out of school and you haven't taken the exam for the first time, or if you're taking the exam multiple times. But I mean, rule of thumb, good 4 to 6 hours a day, if you're able. I remember I had somebody tell me you need to be studying 15 hours a day. And I was like, in what world is anyone going to be able to study 15 hours a day? Make that make sense, old lady who hasn't been fucking at bedside in 25 years. Huh? So I need for these teachers to be realistic. OK, it says, do you like simple nursing as an NCLEX prep tool? So I think simple nursing is cool. I like simple nursing. I like simple nursing's YouTube channel. Especially like for pharmacology. That was one that I looked at a lot. Someone told you what? 15 hours? Wendy. I'm gonna call you Wendy P. Wendy P. Ain't no way. Where you gonna get 15 hours in a day? Especially when you work 8 of them. Oh, somebody told you what? Somebody told me what? I'm lost. I'm confused. I'm totally lost now. I don't even know what I was going off on a rant. Hey, but what other questions do you guys have? I appreciate you guys hanging out with me. It's already 7 o'clock. I'll probably hang out for like another half an hour. But I mean, it all just depends on, how much people are participating and stuff like that. Those that are interested in the coaching, you guys, like I said, you guys can check that out. And of course, if you have any questions, which I know that you will, you can schedule a one-on-one call with me and we can talk about that. So when you go to the website's going to tell you everything that coaching offers, right? But if you have questions, which I know you will, just schedule a 15-minute call or what I call a mentoring call. And we will we'll talk more in depth about what coaching will get you. It says, do you recommend studying for NCLEX while still in school, or should we get through school? So Nikki, what I would recommend is that your main priority right now is to get through school. Now, when you start getting close, when you're in your last semester of school, that is where you need to start studying for NCLEX. And you need to start studying heavy for NCLEX like a month before you graduate. And by that, just getting familiar at the beginning of the semester, but a month before you graduate, start heavy. Because if you think about it, you'll give a month before, and then the month you graduate, that puts you at 2 months of studying heavy for NCLEX. And then by the time you get your authorization to test, which is like 2 to 4 weeks after you graduate, you jump on the first testing center, first seat that's smoking. That puts you like right around 2.5 to 3 months. And it'll still be fresh in your, the school stuff will still be fresh in your head. The studying for NCLEX will still be fresh in your head. Go take that exam. Hope that helped. You're welcome. I got you. What other questions do you guys have? What else? Shout out to everybody that's just now jumping in here. Hey, we do NCLEX questions. And by we, I mean me, and you guys participate. I do NCLEX questions Monday, Wednesday, Friday at 5:30. We just did 30 of them today. And then we do an Ask Me Anything to follow that. So essentially, if you have any questions about, how to get into nursing, pre-nursing stuff, all that good jazz, you guys can check that out. Nurseslabs.com. And of course, if you guys got to go check the link out in my bio, Monday, Wednesday, Friday, and then everything else that's offered. If you're looking for a free download to help you with test taking tips and strategies, I have a free download that's in my bio as well. Thank you for the info. Wendy P, you are welcome. You are welcome. But what other questions do you guys have? Miss Wendy Watt. Ma'am, I just saw your stuff pop up there. So any recommendations for the nurse essay for acceptance? Oh, that's a good one. So it says just scheduled, can't wait. All right, ma'am. I see you. I saw your stuff pop up there. Hey, make sure you fill out that intake, because if you don't fill out that intake, then I will cancel it. You wouldn't be the first person that I've canceled on, but just that's what we call attention to detail, right? But I am excited. Can't wait to talk to you. So the recommendations for the nurse essay. Okay, cool. Awesome. Recommendations for the nurse essay. Honestly, you just talk about what is your why. What is your why on why you want to become a nurse? That's the stuff that they want to see, right? You want to know what's a really, really good one? Putting your description. Chat GPT. Just saying. You can use Chat GPT can literally write an entire essay for you, and then you just tweak and peek it to put your name in there. You know what I'm saying? You can literally tell Chat GPT all of the details and descriptions, and you can throw it up, and it'll write a whole damn novel for you. It says, please, how do I register for NCLEX as a registered nurse assistant? What? I don't know exactly. I don't know what that means. A registered nurse assistant. You're talking about like a CNA? I don't know exactly. That's a pro tip. That's free. That's free. You know how much it costs for me to give people that knowledge? Nothing, because it's free, because ChatGPT is free. But you can smash that like button and get carpal tunnel from me. You know what I'm saying? So, but no, ChatGPT is great. Shout out, y'all better get used to this AI. Y'all better get used to this AI. It is here to stay. Just like when people didn't like the internet, guess what? It's here and y'all love it. AI is here and y'all loving it too. So don't play. Yeah, get used to it, because it ain't going away. It says, why does nursing classes focus on fluff writing stuff when you don't use it in practice? Because it's all about theory and it's all about education. That's why. It's all about theory and education. They make you write so you can understand the baseline theoretical education of what nursing is about. And then you may not use it. And remember, it's academia. It's academia. They're teaching you the basics of how to become a nurse, and you learn how to actually work as a nurse when you are on a floor working somewhere, right? That's just how it goes. But hence, that's why clinicals is there. But is it Shida or Shida? There is no registered nurse assistant. It's only a registered nurse. So if you're talking about being like a certified nursing assistant, like a CNA, that's like a whole different thing. And honestly, nothing that a quick Google search won't help you with. Like having to learn all this history and nursing stuff that has no point. Well, I mean, it does have a point. But when it comes to the actual occupational hands-on stuff to taking care of a patient, no, you're right. I'm not going to be going up to a patient while I'm doing an IV. In Florence, I trust. Like, I'm not going to do that. I'm not going to do that. That's funny, though. But it says, I mean, how do I register as a nursing associate? You talking about, I'm assuming you mean like how to get your associate's degree as a registered nurse, Shida. I'm assuming that's what you mean. How does it go? Hated writing as I am a hands-on learner. Bear with it, and I will go by. So honestly, you just go into ChatGPT. You can create a login with your Google account, and then literally it'll bring up like a chat bot, and it'll say, "Hey, like, what would you like to learn?" You literally can type in there, create a 4-page personal statement talking about why I want to become a nurse, period. Include like whatever your personal stuff is, and then watch it just fucking regurgitate it. You're going to be like, wow. And then I'm telling you, you're going to love every bit of it. It says, okay, I'm a foreign nurse and I have to do a language test in the NCLEX test and I'm afraid of. But you're going to be afraid of it anyway. So just do it. Everything that we do that is new, we're going to be afraid of it. I'm going to tell you guys the term, and some of you guys don't know it, but the term is called get off the beach. So during World War II, when the Allied forces invaded Normandy, France, to stop Germany from doing their thing, the Germans pretty much had the Allied forces pinned down at a top advantage, and the only way that you were going to survive is that you had to get off the beach. So you were either going to be scared and stay there, and your chances of dying were 100%, or you were going to run through it with your chances being a lot higher, but you were going to do it scared. So that's what I talk about. Get off your beach. Get off the beach. You're going to be scared. Everything new and everything scary. Shit is scary. But what are you going to do? You're going to stay there? Because if you stay there and you stay scared and you don't take your exam, you're never going to progress to taking your other exam, which is the NCLEX. Or you could do your test scared. Pass your language test scared. Go on to take the NCLEX scared, pass that, but you still progressed. So you're going to still progress forward even though you're scared, all right? You're scared of it. Hey, if you're scared, go to church. That's number one. And also if you're scared, cool. You're going to do it scared anyway. All right? So shout out to all y'all in here rocking with me. We got, 60 plus people. Hey, a little bit about me. If you guys are just now new here, I am a nurse. I've been a nurse for 3.5 years. I've worked in ICUs. I've worked in OR. I've worked in PACU. I've also been in the Navy for 16 years. Surge tech, hospital corpsman, master instructor, been an instructor almost 9 years. So got a little bit of everything, kind of a jack of all trades, I guess. Jack of all trades, master of none. I forgot how it goes, but whatever. So whatever questions you guys have. Hey, we did NCLEX questions earlier from nurseslabs.com. Free sets of questions. You guys can go over there and check those out for yourself. All right. How to begin again after failing NCLEX. You need to take a look at your performance breakdown. And you need to see where you had your lowest areas. So like ones that are like below, and then that's where you start. Can one work in ICU without experience? Yes, you can do that. Most people are going to want you to go to a residency program, which if you don't have any experience, I think going into a residency program is not a bad thing as long as you understand what you're going to be a part of when you do a residency program. All right. So there's nothing wrong with doing it. Just be aware, like read the fine print when you do a residency program, but you can most definitely get into an ICU with no experience as long as you do it through the residency program. Okay. So what other questions do you guys have? What other questions do you guys have? I saw some people jump up on here and they scheduled. Whoa, who is that? I think that's Miss Wendy. Okay, cool. All right. What other questions do you guys have? Shout out to everybody. Hopefully everybody had a really good New Year's and everybody was out there, not acting up too bad during New Year's. Why did you become a nurse? I became a nurse because I wanted the increased level of responsibility of taking care of somebody. It was a terrible thought, but it was just like, man, I want more money. Because I was working as a surge tech, and in the military, when you become a nurse, you're an officer and you make way more money than you do as enlisted. So that was one of those things that I realized, like, nah, that ain't really it. But my biggest thing is that I wanted to do something more. And in the environment that I was in, a nurse is a very big deal in the military, especially when you're in a deployed status. So I wanted to be able to do more to take care of, my fellow brothers and sisters that are in arms. So, and that's what I did. And yeah, that's why I wanted to become a nurse. But there's many reasons, but that's one of the first ones that popped up into my head. So, I like your honesty. Look, Jill, I gained nothing. I gained nothing by lying to you. I flat out said I was just like, man, I need to make more money. I can't be out here. But then it's just like, hey, with that money, depending on where you are, comes that responsibility, and that's just the that's just the gist of it. Any tips for a student nurse with ADHD? I would recommend you might want to talk to your doctor about that. And I say that because they may be able to prescribe medications for you if you're not already on medications. But then also if you have any type of anxiety or any type of other disorder, like you can actually have accommodations for your test. I don't know exactly what falls under those, like disorder wise, but you can actually have those looked at as well. Kevin, I forgot to write the date down for our meeting. It's January. It's January 4th. It is January 4th at 1:00. 1:00 Central Standard Time. So, but anyways, that was a really good That was a good question. So, what other questions do you guys have? Also, you're welcome. Also, if you're looking for coaching, like if you're one of those individuals that are just completely lost and you have no idea like where to even start with the NCLEX, or if you've been unsuccessful at the NCLEX multiple times, like myself, I was in the past. I do mentoring and I do coaching in regards to the NCLEX. I actually just this past last week, the 21st and the 29th, I had two of my students that I coach that passed NCLEX. One took it she failed 11 times, and the other one failed 5 times and passed on her 6th attempt. Right? Sometimes I'm not going to say sometimes, but at all times, I recommend everybody getting a mentor of some sort. So like if you're a nurse and you're already working out there and you're trying to become a CRNA, go find a CRNA that's a mentor. Or if you're trying to get into ICU and you want to be the best ICU nurse go find the best ICU nurse that fits your personality. Notice I said fits your personality. And start learning from them. Everybody needs a mentor, just like everybody needs therapy, right? But everybody needs a mentor. But if anybody needs help in regards to getting over that last hump of, joining the greatest shit show on earth known as nursing, LPN or RN, check it out. It's the it's the NCLEX coaching and mentoring. All right. Also, if that's not something that you're interested in, I have an NCLEX course, 7-day NCLEX course. I also have an ebook, or if you were looking for something to kind of just tide you over, I have a 42-page free PDF where I talk about test taking strategies to how to conquer the NCLEX. So all those things are available to you. All right. What advice do you have? Some starting a nursing program? So Danny, I'm assuming you said, what advice do you have for someone starting a nursing program? Okay. First of all, time management, you got to get it under control right now. If you have a family, you better call a town hall and be like, hear ye, this is what's about to happen. I need for y'all to start figuring it out for yourself. Okay. I'm not saying that you have to do that, but your open line of communication I have literally seen where people start nursing school and then no lie, within 3-4 weeks, somebody done broke up with somebody, husband or wife done want a divorce because they don't spend enough time with them. They neglect them and the kids. That's where the support, I'm telling you, it be getting wild out here. So that's the advice. Be prepared to get humbled. You're going to get so much information thrown at you. All right. And so one thing I would recommend is getting into a small group. 3 other people that you vibe with, not somebody that you're in competition with, not none of that nonsense. Getting a group that's somebody that you vibe with. 3 other people, split it up. If you have a test on 16 chapters, you do 4, the other 3 people do 4, break it up. That's 25%. You do your notes on those 4. They do their notes. You bring them all together at the end. And now you literally have all of the 16 chapters of notes, right? 25% of your work can reap you 100% of the benefits if everybody puts their work in. That runs with a risk, but trust me, everybody in that group is going to be wanting to put in 100% because everybody wants to pass. All right. Hopefully that was enough. Hopefully if that makes sense, let me know. Let me know if that makes sense. But shout out to all y'all. I'm going to hang out for about another 10 minutes. What other questions do you guys have? What other questions do you guys have? You like that idea? I'm glad. I'm glad you like that idea. Some people try to gatekeep and they'll just be like, well, I had to figure it out. You need to figure it out. That's one thing I actually hate. I hate people that do that. I remember I asked somebody about stocks and he flat out told me, well, you got to go figure it out. And I'm like, huh? You can't just tell me like, hey, like what programs you use. And then, at least like point me in a heading. And he's just like, nah. And I'm just like, all right, cool. Needless to say, I don't talk to that dude no more because who gatekeeps like that? But whatever. How do you avoid the toxic environment with competition in school? So what do you mean exactly? That's a lot. It is a lot of trust. I'm going to tell you something right now. If y'all go to my Instagram is @thebootnurse, right? If y'all go to my Instagram and y'all scroll all the way to 2018, you're going to see me in a picture with 3 women. The two Jennifers and a Valerie is what I call it. Jennifer, and Valerie. Those 3 women are the reason why I became a nurse. Like, we were all the reason why we became a nurse. All of us. Like, we did notes together. We had study sessions together. It was just us 4. We all had our sections that we had to do. We all brought them together. We all learned from one another, right? Because it didn't really matter. Like, it doesn't matter. Like, you're going to get your own individual grade. It doesn't matter how good my damn notes are. You still got to put in the work. You know what I mean? So if y'all go over there and y'all look, I trusted those women just as much as they trusted me. And I was the social butterfly. You see what I'm saying? So yes, you're going to have that trust. But here's what I'm going to tell you. When you start working out there as a nurse, you're going to have to trust other people as well, especially if you're doing, the management and delegation aspect of being, doing the team aspect of working as a nurse. And you got to tell your tech what to do. And you got to tell LPNs what to do if you're an RN and stuff like you got to do all that. So why not start building the trust while you're in school? I don't know a lot, but I do think that. So hopefully, Nikki, that answered your question. I just want to thank you for every advice and giving us force and courage to go. Exactly. You're very welcome. Who's that? User 21. You're very welcome. Like I said, I gained nothing from lying to y'all. And the reality is, it's just like, I've noticed, and I've been in the military for a long time, but I noticed that people gatekeep so bad because, they're just like, they're afraid of competition or they're just afraid of other people. And that tells me that you have a self-esteem issue and I like competition. I like it. And so, but that's just going to tell me, it's just like, a lot of people don't want to tell people ideas, but I'm just like, yo, I'll tell you what an idea is, but there's a big difference between $1 million idea and $1 million execution. And you're not going to outwork me. I can guarantee it. I guarantee you're not going to outwork me. So if you put in the work, it shouldn't even matter. But that's just how other people think, because dog eat dog world, right? So civilian world is a lot different from military world. And I'm very still military world-esque. But I'm going to be hanging out probably about another 8 minutes. So what other questions do you guys have? Hey, so we do NCLEX questions Monday, Wednesday, Friday at 5:30 Central Standard Time in Texas, because that's the only time that matters. Hope everybody had a really good weekend and had a good New Year. I'm just answering questions. We're talking about, pre-nursing, nursing school, NCLEX, new grad stuff, all that good stuff. PM what? Yes, PM. Well, obviously not AM, because why would I be here at 5:30 Central Standard Time in the morning? Come on. So I don't know what part of the world that you're in, but 5:30 Central Standard Time in the PM. In these here United States of America. All right. So what other questions do you guys have? Don't be shy. Don't be shy. I got like 80 people up in here that are just sitting and listening to me run my mouth. So what else you got? Sorry for the lighting. It's like ridiculous. Yeah, that's better, but it's ridiculously bright. But I'm trying to fix that. So also all of my TikToks, at least a good majority of them, will end up on my YouTube. If you guys don't follow me on YouTube, make sure you guys go over there and subscribe. I actually have that link in my bio as well. So, if you missed a set of questions, just go up there and check them out. Today is Monday. I'm pretty sure. I think I posted one that went up there as well today. I think it was like 10 or 11 o'clock this morning. So if you guys want to go over there and get that knowledge for those NCLEX questions, you surely can. Look, I'm out here trying to give y'all all the knowledge. all of the knowledge. But what other questions do you guys have? Or do you guys just want me to sit here and talk? You guys see, got all my papers right there. Mess, I tell you. And then, of course, we talk about leadership, right? I got a few of those actually posted around my office. And then, of course, my entire brain is on this whiteboard. So what else are you guys thinking? What else you got? Oh, y'all ain't got nothing for me? Everybody just comes for the questions and they're just like, bye. All right, cool. All right, well, if nobody has any other questions, I'm going to go ahead and I'm going to hop off. Last little shameless plug for me. If you need coaching or help with NCLEX, you just don't understand like why you're not doing well or what you're not understanding, you guys can check that link out in my bio. 7-day NCLEX course. Once you have it forever. Forever. You guys can check that out. That link is in my bio. It's going for $97 and you get all of the updates that come in there. Right now, there are 61 videos in there. I'm projected to have well over 200. And yes, I do all of the recording. I do all the editing. I do all that stuff. So I'm a one-man army. So I appreciate everybody being patient with me. You guys can check out the ebook that's in the bio, as well as you guys can check out that free download for yourself as well. Welcome to 2024, ladies and gentlemen. 2024. There's no more of that new year, new me shit. There's no more. Because you're going to say new year, new me. And guess what's going to happen at the end of January? It's going to be the same damn you. You see what I'm saying? It's going to be the same damn you. So guess what? Improve upon the you that came into 2024. 2023, you should be a new person. You should be an improved person. Sorry. You should be an improved person from 2023. Do you have more for students? So bad chick, the biggest thing that's inside of the 7-day NCLEX course is there's a lot of content that's in there. So but I don't do a lot of stuff for students. I mainly focus on NCLEX. You got the free download. Okay, Miss Wendy, shout out to you. Lord, I don't know what I did. I just pinned somebody's stuff. Oopsie, didn't mean to pin that. I'll just leave it there. It's fine. I'm a new nurse in my country, and I did take care for 30 patients every day. What? Take care for 30 patients every day. Okay. How to best study. It all just depends on you. It's like, what type of learner are you? And that's more of a convoluted question. You know what I'm saying? It's like, what type of learner are you? And then that right there will determine how the best way for you to study. So once you determine that, like, are you auditory, read, write, kinesthetic? Are you a combination of all those? Are you visual, combination? Think about that. And once you're able to think about that, then you can apply that to how you will learn to retain information. Okay. So, but yeah, I appreciate everybody. Hey, like I said, it's 2024. There's no more new year, new me. It's the new year, but an improved you from last year. All right. So just think about those things. I appreciate everybody being here and rocking with me. We will be back on Wednesday. And until then, everybody be safe. You guys keep getting your study on. Hey, it's time to get to work. Time to get to work. Those tests are coming up. Those exams are coming up. School's coming up. Stop playing with yourself. Pause. You already know what I mean. All right. And I will see everybody on Wednesday. Bye.